Hi, everyone. Welcome to the Cost of Cuts, the real-world impact of proposed SNAP changes, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation, and we'll send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, click Show CC in the bottom taskbar and select English as the spoken language. At the end of the presentation, we'll have time for questions and answers. To ask a question at any time, use the Q&A tab also in the bottom taskbar. With that, I'll pass it off to Gina Platanino, SNAP Director at FRAC. Take it away, Gina.
Thank you, Stephen. Next slide, please. We can go right where the presentation begins. We go there. Thank you, everyone. We know there's a lot going on with the unnecessary lawsuits that have happened. We're thrilled that we have such an amazing advocates who keep litigating this issue, but just want to call it out. As we talk about the government shutdown, we didn't have to be here. The lawsuits are great. We're delighted about the orders that are coming from the courts, but USDA has the authority and could have acted at any time. SNAP benefits did not need to be delayed. SNAP benefits could have moved forward. And even now with the orders, with the court's decision, the administration had the opportunity to tap into Section 32 reserves that would have fully funded SNAP instead of creating the additional barriers and burdens now for state agencies to calculate the prorated amount and then send that information over to USDA. So we just want to acknowledge that before we talk about what is coming and really connect it to, yes, there is a lot of unnecessary harm being done by the administration, but this is in line, unfortunately, with the agenda that was set out this summer with the new SNAP cuts, right? Today, we're talking about the awful time limits, but I think it's important to note that, first, SNAP Ed was defunded. Expanded time limits is what we're going to focus on. But there are other things in place that are impacting individuals. And after the government reopens, after people stop talking about SNAP, individuals will continue to lose benefits. And this time next year, we're going to see millions of individuals who no longer will be eligible for SNAP because of this terrible reconciliation bill that was signed on July 4th. So we just thought it was important to keep talking about this because beginning November 1st, individuals who apply are in many states will be whole. We are now part. We will have to make sure that they are eligible within this new time frame. So as we said, all of these things, all of these new provisions are going to increase administrative costs. There's going to be new staff required. And increased staff really means more funds, which state agencies don't have and which are tapping right now into the reserves to do what the government is supposed to be doing and what USDA could have done at any time and can still do now, which is to fully fund the program. So really wanted to make sure that people knew before we get started where we are. Next slide. And just flagging that all of these things, all of these are administrative actions where, particularly in time limits, state agencies are going to have to touch cases multiple times, which will lead to state agencies having higher costs of error rates, which will require them to pay a percentage cost of share beginning in FY28. So just wanted to flag that for individuals as well. Next slide, please. And flagging that this is, again, funding that we could have utilized in other things, universal childcare, tackling homelessness, all of these issues that are very needed for our states. But because of the new reconciliation law, states, in order to keep SNAP funded, particularly those larger states, will have to spend billions of dollars in order to keep the program moving funded. Again, funding that could have been utilized. And this is a new funding that will come, right? States are not having their budget. It would just mean that they will move things around, they will shift things around, and it will trickle down into states having less resources to be able to help their communities as you look at and making sure that SNAP becomes a line item budget, which has never been done before. Next slide. And just again, just really want to focus that SNAP really matters. It not only reduces hunger, but it bolsters local economies, which is what we're seeing now. Retailers are not getting the funds that they were relying on. Individuals are having to choose between paying for rent and paying for food. Um, People are having to decide whether they pay for medicine or not. SNAP is such an economic stabilizer, and it reminds us that the worst health outcome is hunger. And when these nutrition benefits that people rely on are not there on time, or they're not there for people, it is whole communities that suffer. Next slide. And talking about the economic impact, right? This shutdown is costing billions of dollars, but nowhere else do you see it as well as into what SNAP brings into these local economies. And that's we seeing states really picking up the tab and trying to do what USDA could do at any moment. It has creates thousands of jobs. It brings billions in wages and in local and federal taxes. And these numbers are just from local grocers, which make up less than, believe, 30% of the 266,000 retailers that are authorized across the country. Next slide. And again, SNAP, for every meal that SNAP provides, for every meal that food banks provide, which we're so thankful for the work. And remember that food banks were there for in case of emergencies, not to become the source of food for individuals, which is what has become for as the government refuses to make sure that benefits are funded, is that for every meal they provide, SNAP provides 9. Next slide. SNAP demographics. It's important to know the majority of people who utilize SNAP are white Americans, followed by African Americans, and then Hispanics, and those are terms that the USDA utilizes. But if you look at the food insecurity rate, white individuals who get to utilize SNAP at a higher rate also have a less food insecurity rate, unlike African Americans and Hispanics, that is almost double that. Next slide. And remember that the biggest participants of SNAP are children, followed by older adults and people with disabilities. And if we look at the correlation between poverty rate is very close and lead in terms of who has access to these benefits and who has a less rate of poverty. Next slide, please. And before we get into time limits, we'll finish with this. Hunger cost, not just in terms of health, but it also in terms of economy, from direct health related costs to indirect costs, such as loss of work time due to workers' illnesses or workers providing care for sick families. And then indirect healthcare related costs, such as primary and secondary dropouts, disciplinary issues, cause our economy over $173 billion. And keep in mind that the reconciliation bill took away $187 billion from the SNAP program. Next slide, please. Next slide, please. So where we are now, these SNAP time limits, as we call them, is that in order to remain eligible for SNAP benefits, non-exempt individuals must register for work at application and every 12 months after. They must participate in state-assigned employment training programs or work fair programs. They might provide information on employment status and availability, report to employers. I'll just say that there is a very specific system of individuals that they have general work requirements, as we call them, and then time limits. Time limits are very different. Right? General work requirements apply to everyone, right, who applies for SNAP. And majority of people in SNAP are working. They just can't show enough hours. Next slide. History of SNAP. I think it's important for us to know that this whole thing of time limits, besides the general requirements that we are talking about, is that in 1996, under the Personal Responsibility Act, next slide, individuals who were 18 to 49 were required to work 20 hours a week in order to be exempted. If not, they can only get SNAP for 3 months in a 3-year period. And unless they were exempted. But I will flag that even though disability is an exemption, we do know that a large percentage of people who with a disability have a difficulty accessing SNAP. So while the exemptions are there, it's still incredibly burdensome for individuals and state agencies to apply these terrible time limits. Next slide. There is a plethora of research, even from the signage of this bill, that shows that this should not have happened. It did happen, and it is unfortunate. And FRAC and many organizations have been working incredibly hard to be able to repeal this. But even President Bill Clinton, when he signed the bill, said that it fails to provide support to childless adults who want to work but cannot find a job, which is the situation that we find ourselves in, and are not given the opportunity to participate in a work program. There are limited slots. Employment and training, they do not start right away when individuals get cut off. For many individuals, these apprenticeships have big start dates, and it doesn't come with transportation. It doesn't come with computers or internet or stipends for gas, so many things that are barriers for individuals to be able to access these jobs. Next slide. And next slide. So 2023, what happened? Under the fiscal responsibility, that number 18 to 49 was expanded to those age 54. And we did see that a whole bucket of new individuals were being unnecessarily cut off and suffering from this. But then it did add some certain exemptions, because so much research showed that these very vulnerable populations have a difficult time showing enough hours, right? Those were our veterans, our unhoused individuals, and former foster youth age 27. It did also have fewer discretionary exemptions in terms of when states can say we have insufficient jobs, we're going to exempt that. But it still left states enough exemptions to be able to utilize them at a time. Next slide. Now, HR 1, as we call it during the summer, really changed everything. It expanded it from 18 to 54 to now 18 to 65, right? That means individuals, even those who have retired at 62, even those who have to leave the workplace because they are helping their children with their grandchildren. This also includes, for the first time in history, parents, grandparents, or caregivers of children 14 and older. It used to be 18, which is going to be incredibly harmful, because a 15, 16, 17-year-old are still children that need their parents. Adults experiencing homelessness, including homeless families with teenage children, are cut off, are now part of this time limit. Youth aging out of foster care are no longer exempted, and veterans are no longer exempted. It does provide an exemption from time limits for certain American Indians, and the USDA has specific guidance on who is eligible for that provision. Next slide, please. As we said, there's deep and long harm from the time limit. Unlike other programs, states have absolutely no obligation under the SNAP time limit to offer skills training, employment services, or any transportation assistance to individuals before cutting them off. HR 1 did not increase funding for this particular provisions, and it also includes individuals with undiagnosed impairments. And states are not obligated to help them find a job or medical providers who can diagnose or treat their conditions. And we do know, and we have plethora of research that shows that it denies food aid to individuals with impairments who are actively looking for work, but are unable to find them. This specific population often faces the most significant barriers to work and could benefit from employment training and barrier remover support services, but they are not there. Next slide. Next slide. We also want to flag that some of the people who will be impacted the more are women, because the childcare that they provide, it's not counted, it's unpaid, and that many individuals are raising their grandchildren. And those who now are 14 and under are the only ones who are going to be exempted. 14 and up, they are now have to make sure that they are showing these hours if they're living in their household. Next slide. Next slide. Next slide, please. Sorry, we're running out of time. So wanted to, sorry, I know we're closing down on time. I want to make sure that we live into the panelists. Overall, these time limits are incredibly harmful, and they are unnecessary for state agencies. The U.S. Department of Agriculture issued guidance, very limited guidance, and many states, even during the shutdown, have implemented this guidance, meaning that individuals who are applying for SNAP now, beginning after November 1st, will be held under these new rules. It doesn't mean that everyone will be cut off right away. It means that when states are recertifying or doing interim reports, they will be able to notify these individuals that under the new rules, even if you are a veteran, they will only have 3 months to be able to access these benefits. And it wasn't just SNAP that was harmed under the reconciliation bill. There were other programs as well. And some of these were the Medicaid, which also for the first time um, will also have work requirements. And many individuals who are in SNAP are also within this program, and it will be applied differently. So to take us to what we should be concerned about in some of these best practices, I want to turn it over to Amanda Bank, who's the program officer at Center for Healthcare Strategies. Amanda, turning it over to you. Thank you.
Thank you, Gina. I'm so grateful to be here alongside the other panelists. Again, I'm Amanda Bank. I'm a program officer at the Center for Healthcare Strategies. And building on the overview that Gina just provided, I'll be speaking to how expanded SNAP time limits intersect with the new Medicaid work requirements and hopefully highlight some challenges and opportunities for alignment to better support folks navigating both systems. You can go to the next slide. So as just a quick overview of the Center for Healthcare Strategies, we're a nonprofit based in New Jersey, but we work with stakeholders nationally to strengthen the U.S. healthcare system to ensure better and more equitable outcomes for those served by the Medicaid program. And while we do a lot of different types of work across various Medicaid stakeholders, I spend most of my time working at the intersection of Medicaid and food and nutrition insecurity and thinking about the intrinsic connection between food access and health outcomes. And that's why ensuring folks have continued basic food access through programs like SNAP, as well as coordinating across SNAP and Medicaid, is so critical and important to the work that I do. Next slide. So, like Gina mentioned, H.R. 1 includes provisions to reduce federal spending on SNAP by almost $187 billion over the next 10 years. And this is, again, the largest funding reduction in the program's history. And a large part of these reductions will be achieved through expanded work requirements for able-bodied adults without dependents or ABODs. These SNAP reductions are coinciding with almost $1 trillion in Medicaid reductions projected over the same 10-year time period. And Medicaid reductions will also be achieved in large part through new work requirements, which are also being referred to as community engagement requirements. And these are specifically targeted for adults covered through Medicaid expansion. Medicaid expansion population largely overlaps with that ABOD population, and there are about 20 million adults who are receiving Medicaid benefits as part of the Medicaid expansion population over 43 states. So this means that 20 million adults will be subject to navigating these new Medicaid work requirements. And we know that SNAP and Medicaid serve largely overlapping low-income populations, and the increased administrative burden of work requirements across both programs will very likely affect program access, which will increase food insecurity and worsen health outcomes. Next slide. So I just wanted to give a quick lay of the land comparing work requirements across the expanded SNAP time limits as well as the Medicaid work requirements. As I know many of the folks in this room are probably more SNAP focused than Medicaid focused, and it's really helpful to just see these requirements listed side by side. So the first is timeline. As Gina just mentioned, expanded SNAP work requirements for ABODs went into effect starting November 1. Meanwhile, Medicaid has a slightly longer runway for implementation, with those slated to begin in January of 2027. I know that sounds like a long time, but again, work requirements are totally new for Medicaid, besides in Arkansas and Georgia, where they've been implemented previously. And so implementation is going to require major changes to states' eligibility systems and data sharing infrastructure, and this January 2027 timeline is going to sneak up very quickly. When it comes to the number of hours for work requirements and the targeted populations, there is general alignment for the Medicaid population and the ABOD population. Both are requiring 80 hours per month, and the SNAP ABOD work requirements are for those aged 18 to 64, and Medicaid is for those aged 19 to 64. So there's just a 1 year time difference there, but generally targeting the same folks. Required outreach is slightly different. SNAP is requiring a written notice and oral explanation at certification, recertification, and then whenever a new household member becomes subject to work requirements. And then Medicaid is requiring a notice in writing and then one additional form of communication between June 30th and August 31st of 2026. So again, while I mentioned that not full implementation of Medicaid work requirements has to be underway until 2027, there is less than a year before individuals need to be notified and states have to start getting these systems in place. For verification, SNAP uses a look forward process at certification and then every year recertification, meaning that the client has to verify their current work and they're granted 3 strikes before being disqualified from SNAP. Meanwhile, Medicaid will be using a 1 to 3 month look back process prior to enrollment, and then every 6 months during redetermination, meaning the client has to be compliant with the new work requirements for 1 to 3 months immediately prior to their application or recertification for Medicaid. And so what's the impact of all of these work requirements? Well, because of the anticipated administrative chaos, 2 million people are estimated to lose some or all of their SNAP benefits, and 4.8 million people are estimated to lose their Medicaid benefits. Next slide. So you can see on this slide that some individuals are exempt from work requirements, and there is quite a bit of overlap between exemptions. Although, like Gina mentioned, HR 1 removed previous ABOT exemptions for veterans, individuals experiencing homelessness, and youth aging out of foster care, which are extremely vulnerable groups. So these groups are now required to continue to meet work requirements to maintain their SNAP eligibility. I will flag, though, that those 3 vulnerable groups are exempt from Medicaid work requirements. Something that I also think is really important to call out is that meeting SNAP work requirements explicitly exempts individuals from Medicaid work requirements. So this really highlights an imperative to coordinate work requirements across these programs, as this is a really easy way to support individuals in only having to navigate one program's work requirement. Next slide. So now that we've got a bit of a lay of the land, I wanted to speak to how we can sort of mitigate harm and streamline these work requirements. And a lot of this starts at the state level. So states can coordinate work requirement verification systems to reduce administrative burden and minimize additional action from the client. And I listed here just a few opportunities for streamlining. First, because work requirements are totally new to Medicaid, Medicaid agencies can and should leverage existing SNAP systems like the eligibility and enrollment system and employment and training systems to screen for individuals that are completing work requirements and then automatically exempt them from Medicaid work requirements. And this would be a really easy place to start. States can also leverage something called ex parte verification processes, which is a state's attempt to use reliable information already available to the state agency to determine program eligibility without requiring additional information from the individual or client that's applying. And so a lot of states already use ex parte for determining SNAP or Medicaid eligibility or vice versa. And it can also be used as a really useful tool to help identify members who either qualify for work requirement exemptions and then exempt them, or to help coordinate the verification process for those who are subject to work requirements. HR 1 also appropriates $400 million to support work requirement implementation, and $200 million are designated for direct distribution to states. And so while that won't be a lot of money spread across all 50 states, we do see this funding as an opportunity for states to either develop or bolster their existing data systems with the aim of streamlining SNAP and Medicaid work requirements. States can also invest in a cross-trained workforce to better support individuals navigating these systems and also reduce outreach costs. So a cross-trained workforce at the Medicaid and SNAP level will be able to provide technical assistance to clients who are probably going to have questions across both of these work requirement programs, across both programs. And this can also help reduce outreach costs by ensuring that staff provide more accurate and efficient service upfront, which will hopefully minimize incomplete or accurate applications from clients. States can also develop cross-agency advisory committees made up of state leaders at both the SNAP and Medicaid agencies in each state. And this can hopefully facilitate a more coordinated approach for work requirement implementation and hopefully better center the client experience and the client that has to navigate across both systems. Next slide. And then beyond coordinating at the state level, there is a real opportunity for community-based organizations to serve as trusted resources to support SNAP and Medicaid work requirement implementation. So once staff at a CBO are trained, they can then provide hands-on support for individuals meeting work requirements by verifying work, as well as providing volunteer opportunities on site that can then count toward work requirements. CBOs can also be trusted resource and leverage their communication channels to raise awareness about these new work requirements. And they also are very well positioned to gather both qualitative and quantitative data on the impact of work requirements, and then report these effects to policymakers to hopefully inform future policies and mitigate future harm. Now, we see CBOs like food banks as a really prime example of organizations that would be really well poised to be like a one-stop shop to support work requirement implementation. But we also know that they are absolutely slammed at the moment with funding reductions overall in the nonprofit sector, as well as the support that they're providing to the increased client base amid SNAP ceasing to be funded November 1. So this is more down the line. You can go to the next slide, and I'll just put a quick plug in for CHCS's new work requirements implementation series, which we're regularly populating with new resources and trying to support all the stakeholders doing amazing work on the ground to support work requirement implementation. And I'll be here to answer any questions in the chat or during the Q&A, but thanks all for listening and for all the work you do, and I'll pass things off to Jenny.
Before Jenny goes, just want to say that, this is a very complex issue. And we will continue to have further guidance. And just so how complex it is, imagine state agencies having to relearn all of these guidance, but more importantly, individuals who are just trying to put food on the table, understanding all of this. So it's really going to take partnership because mistakes will be made. And individuals will be erroneously cut off from benefits because caseworkers will not understand that, oh, you're exempted, you're not. And so this is where you as an advocate have a key role to play. And we will continue to make sure that you have the guidance and the resources because it's really up to us to ensure that individuals are not cut off unnecessarily. Thank you, Amanda. And now I'm going to turn it over to our next speaker. Katie Meyer-Scott is the Youth Homelessness Program Director at the National Homeless Law Center, where she focuses on state policy solutions to youth homelessness and protecting the rights of homeless youth in school, shelter, and housing programs. She is an amazing advocate with many years of experience. And Katie, as we talk about all these like very awful issues and impacts, we're really talking about some of the most vulnerable of the vulnerable of the vulnerable, and we're not picking sides, but these individuals are really going to hit incredibly hard. So turning it over to you to talk about how these new requirements really impact this vulnerable population.
Absolutely. Thanks so much, Sheena. And thanks for the opportunity to be here today to elevate this issue. Just briefly, so I'm Katie Meyer-Scott, the Youth Homelessness Director at the National Homelessness Law Center. Just a little bit about the law center. We often call ourselves the legal arm of the movement to end and prevent homelessness. And we do that through impact litigation to protect the rights of unhoused people, and then also policy efforts on this local, state, and national level to advance a right to housing. So I'm here today sort of with both my homelessness rights hat on and then also my previous hat of being a public benefits attorney for many years. If we go to the next slide, one thing that's kind of interesting in figuring out about the effect that these HR1 will have on people who are unhoused is that we actually have some pretty good data to really hone in on what the specific effect will be. Basically, when the Fiscal Responsibility Act was passed in 2003, that was generally not great in the sense that it increased the ABOD age limits. And so there was an overall decrease in SNAP recipients. However, because they added homelessness as an exemption, for the first time, we actually saw an increase in homeless recipients of SNAP, just because people were able to get on the benefits that much easier without having these requirements. So we are now able to see, the difference from before and after, and so we know what's going to happen once that exemption is taken away. So I think just one thing that was emphasized by some other speakers today, like SNAP work requirements, they do not increase employment or earnings for people. So homeless recipients will lose assistance with absolutely no improvements to their job prospects or income. We also know that the people who are potentially subject to these work requirements and time limits, they have higher rates of homelessness, 2 to 4 times depending on the state. These homeless SNAP recipients are also more likely to have co-occurring mental and physical health issues, but are less likely to be on SSI or to have other kinds of official medical documentation that actually proves their disability or their unfitness to work. And then so homeless participants are less likely to be able to meet or to be able to document that they either meet the work requirement or that they meet the disability or unfitness for work requirement. Go on to the next slide. Homeless folks, as you might imagine, have unique challenges when it comes to documentation. We know, last year there was the ruling in Grants Pass that the Supreme Court essentially said that people can be swept and criminalized for trying to shelter outside, even if there is no alternative available. And so we've seen since then hundreds of criminalization bills being implemented across the country, meaning that there is an increase in instability, in constant sweeps, in being moved from place to place for people who are unhoused right now. And what that means is that folks, one, are losing important documentation that they would need to be able to even apply for public benefits in general. And two, just the ability to be able to actually do any of the work requirements or prove that they're doing the work requirements is that much harder. A few things just to kind of keep in mind. I've had some people say, well, people can volunteer, you can do 20 hours of volunteer work a week. And when I hear that, I think people aren't really thinking through like the implications of that. Like, one, have you ever tried to do 20 hours of volunteer work a week? It is pretty difficult. Two, have you ever tried to provide 20 hours of volunteer work for someone who doesn't have a special skill? That is also really difficult. A lot of the homelessness services that we have set up are not sort of prepared to provide volunteer hours for everyone who is participating in their programs. We're just, the homelessness services is just not set up that way. So then to be able to find something else is going to be extremely difficult. And then we also have sort of the ethical issue there of, having someone who is homeless, who is in need of actual full-time employment, to have them instead be spending 20 hours a week volunteering without paying them, it sets up a really bad, I think, just sort of ethical dilemma here. And I linked an article in the slide, basically, about, I think this was in Tampa Bay. They were having homeless people volunteer at the stadium during sporting games in exchange for their shelter, and I just, this really like stretches the morals of what is reasonable here is to have people, even if someone is able to do 20 hours a week, to not pay them for that is a pretty rough situation when there are very few other job prospects for people who are unhoused. The other thing I'll just say is that the commuting time for people who are unhoused can be just completely unreasonable for them to be able to meet 20 hours at paid or volunteer work. Situations on the bus. I think, we hear in New York City that this is an issue about how slow the buses are. It is certainly an issue here in Seattle. In many jurisdictions, it can take, anywhere from 60 to 90 minutes to just even go, a couple neighborhoods across town to be able to get to those opportunities. And then just the extra complication of caring for children, pets, or belongings while you are homeless. You cannot leave your pet in a tent. You cannot leave your belongings in a tent and know that you'll be able to come back to them. Similar situations for those who are sheltered. Oftentimes shelters do not have adequate storage for people. People do not feel comfortable leaving their belongings in a shelter for a long period of time. So, there's just so many challenges of the day-to-day's reality of homelessness. And then the other thing is just the availability of work for people who are currently homeless. A lot of gig work is not available without a reliable car. A lot of sort of temporary or day labor is not going to meet your 20 hours a week. And it's just, the barriers are just really strong there. The other thing I'll just want to mention is, and probably preaching to the choir here, but just there is a trend across the country of like closing the in-person offices or really like relying and favoring online applications or documentation or using the call center. This is just something that is so harmful for people who are unhoused. Oftentimes they have inconsistent addresses and phone numbers, so they don't get the calls, they don't get the notices, they can't sit on a call center for multiple hours. They also, have difficulty sometimes with getting online in a consistent way. So, just sort of thinking through all these practicalities, we know that this is going to be a huge burden. And let's go to the next slide. So finally, we do have some recommendations. What we are sort of predicting caseworkers will be able to do is to do a couple things. One, as someone else had mentioned in this presentation, like rely on the documentation that you already have in the file. If you can use that documentation to show that they meet some other exemptions, such as unfitness to work. And if there isn't sufficient documentation in the file, make sure that you get, the self-attestation of homelessness and the challenges that they're facing. Make sure that you accept or reach out to as a caseworker, like reaching out to, homelessness providers to be able to provide some additional documentation. If a physical or mental disability is mentioned in, any kind of interview, use again those existing records to document. And if they don't have those existing records, like taking the burden on of trying to help get those things, appointments scheduled, getting those documents and records in. And then the other thing is just making sure that staff knows to recognize the signs of homelessness. And to not be in a situation where someone has to like repeatedly re-traumatize themselves, talking about all the challenges that they're dealing with because of homelessness, making sure that it's just caseworkers know to look in the system, to review what's already there, and not have people have to talk about their situation over and over again. And I think just some of the things for like unfitness that you're looking for is like inability to like meet your daily needs, whether that's food, housing, clothing, whatever. The time required to attend appointments due to travel, difficulties in, each day trying to figure out how you're going to get food and where you're going to sleep. Those are some of the things that I think could be documented, even if there is not strong evidence of disability. And so I will leave it there and pass it on. Maybe back to Gina.
Thank you, Katie. Really appreciate that. And just want to remind folks of you have a right to appeal. And Katie, who's also a recovering lawyer, will always tell you how important this is. People have a right to appeal, and if they are entitled to these benefits, they should. And remember that you should always apply for SNAP benefits and do not wait for verifications to have everything ready, because benefits do begin. Your benefit amount will be calculated from the date that you apply. Going along this line is, what about another specific population, which is youth with, with foster care? issues. And so for that, we have Jenny Pockmenger, who joined the Youth Law Center in the spring of 2021 as the policy director, and she works both on child welfare and juvenile justice issues, with particular emphasis on the needs and entitlement of older foster youth. Jenny, turning it over to you to speak about best practices with this specific population.
Great. Thanks so much, Gina. And thanks everyone for joining today. I'm happy to be part of the panel. We're not happy to be confronting all these challenges, but hopefully, as other panelists said, working with all of you on the call and building on your expertise, really thinking about some strategies to keep everyone who's eligible for SNAP, including young people who are transition age youth, connected. So we'll talk a little bit about barriers, but more about strategies. Next slide. So when we say transition age youth, I think it's a term, both this term TAY, transition age youth, and emerging adulthood, that is more common now, and people do understand this as a specific developmental phase in life, roughly between age 18 and 26. What we do know, and we know a lot about this time period now, and many of you who have young people, your children at this age, you have learned a lot about this time period too. It is a great time of change, both in terms of brain development, but also in terms of just changes in the young person's life, in terms of making decisions about their future, next steps, and their as well as identity and other of those big issues that you probably recall as you were leaving your late teens and navigating your early 20s. One of the things that has changed a little over time is that actually we're seeing more young people in that transition age or emerging adulthood phase, more of those young people remaining at home with parents or family members for longer periods of time. And that's not necessarily a bad thing. It is just a reflection both of higher education and training really being necessary for employment, as well as changes in the economy. So we do have this research from the Pew Research Center that shows the data about 57% of young people 18 to 24 are living at home with parents and relying on them for a lot of financial and social support. And so we just want to acknowledge that as a trend. So when we look at other populations that do not have the support of family, how important some of these social supports, including food security, are. Next slide. And one of the things we also do know about this phase of transition age or emerging adulthood across the population is that young people at that time are at high risk for food insecurity. So 1 in 4 do experience food insecurity. And then we have kind of that complementary or overlapping data from the Hope Center. We know all college students aren't transition age youth. Certainly we have college students that are of all ages, but a large number of college students taking the survey were transition age youth, and we're seeing a lot of that food insecurity on campus. And now when we kind of transition to the population, we're going to dive deeper into youth aging out of the foster care system. We do know that their risk of food insecurity is even more enhanced than transition age youth in the general population. Next slide. So what are some of the things we know about youth leaving foster care? The numbers in the last even 10 or so years have wavered between about 15,000 and 20,000 youth aging out of foster care. And when we say aging out, we mean that a youth is leaving the foster care system basically because of their age. Services ended at a particular age, and they were not reunified with family, and they were not placed with another family in guardianship or adoption. So really, they are leaving the system on their own. One of the things we know that is relevant for our SNAP conversation is some number of youth, and that number has been growing, age out of the system with what's called special immigrant juvenile status. And that is a protected status. However, youth who have SIJ status are waiting for their green cards. And as you know, that group now, if they do not have their green cards and don't fit into the other couple of categories for non-citizens, are not going to be eligible for SNAP. So we do have a good number of youth leaving foster care that can't even access SNAP. The other thing we do know is that based on kind of looking at that data I just mentioned about many youth, transition age youth, relying on parents and other social supports, formal social supports, many youth leaving foster care don't have that benefit. And so they are really facing a lot of economic and social support gaps as they leave foster care. And then the last thing we just wanted to flag is that earlier in the presentation, Gina mentioned the Fiscal Responsibility Act of 2023. At that time, youth with experience in foster care were exempted from the work requirement. And in many ways, that was responsive to these challenges I'm speaking of. Challenges that young people face with both having food security and then other challenges that just make connecting with and staying eligible for SNAP difficult. Next slide. And so some of those barriers I've already mentioned, but unfortunately we do know a lot of youth who do age out on their own face food insecurity. So they do face some of those challenges that Katie just mentioned about, challenges with establishing a permanent address, challenges with just having enough stability in their life to complete tasks like the application for SNAP and other things. Many youth in the foster care system have experienced trauma, and that also can create other barriers. As I mentioned, lack of consistent social support. And also, as we're thinking about transition age youth, many haven't had previous connection with SNAP and really understand the process. And many do not know, and some of you might be aware of this as if you are working with youth leaving foster care, they might not even be aware of the changes in HR1 and that they are no longer exempt from the ABOD work requirements. Next slide. And so we do want to focus on, even with all these challenges and these challenges that young people will be facing with connecting with SNAP, some of the recommendations we are suggesting, and the first are related to systemic advocacy. If you are working in your state to implement HR1, really emphasizing that you play a role and make sure to your greatest ability that the policies put in place really are responsive to young people. So some of the things that we would really recommend, the first is more a child welfare system recommendation. There is a legal requirement to do transition planning. So that's really effectively discharge planning for youth as they're leaving foster care, and really making sure the connection with SNAP is made prior to youth discharging, and also that enables them to have some support navigating these new rules before they leave foster care. We also really encourage SNAP agencies at the state level to really consider how histories of trauma and abuse impact an individual's ability to work. So when states are thinking about that unfitness exception, that Katie mentioned, thinking about how histories of trauma, again, might impact an individual's ability to manage the obligations of work. We also would recommend that your rules really allow an array of individuals, including social service providers, mentors, individuals that might be working with transition age youth, to be able to provide certification of unfitness if verification is required. One of the things that we do really want to note is that many transition age youth are working, and many are in work programs that are TAY focused, part of the WIOA Act, a lot of different workforce programs for transition age youth. And I think we're not sure that SNAP agencies are as familiar with those work programs as they are with their SNAP E&T programs and other kind of quote unquote adult work programs. So really want to encourage SNAP agencies, and many of you who are on the call who might know the youth workforce kind of ecosystem more intimately, to really work with the agency to ensure that individuals can meet the work requirement through participation in approved workforce programs, and making sure these TAY programs are acknowledged as meeting the work requirement, and also that the SNAP agency kind of is aware of them if they need to refer a young person. We also want to make sure that young people who, and this is not just for youth leaving foster care, all our transition age youth who are in college, there is an eligibility SNAP requirements for those students, and we do want to make sure that students are given support to navigate those, and that there are as many connections on campus for the young person to get support, whether it's a basic needs center or it's the accommodations office at campus that might be able to help with supporting any documentation of that unfitness exemption. And then, of course, we really do want outreach material that is vetted by youth, developed with them, because we know that it is going to be challenging, again, for some young people who really haven't interacted as much with SNAP and may not be aware of the new rules. We really want to make sure communications take into account their age, their experience, and understanding. Next slide. And then I know we're short on time. These next recommendations are for any of you who are doing more individual advocacy, and just some recommendations about, working with young people, doing more of that support and warm handoffs, really trying to connect young people with agencies that can help with applications and then support them in an ongoing way to help keep them connected with SNAP. Definitely, as Gina mentioned, connecting them with civil legal service providers is really important to help make sure if they do need to appeal any denial or reduction of benefits. And we will have some more tips, both implementation and individual advocacy tips, coming out soon. If you are doing any implementation work or just individual advocacy with transition age youth, and will be available to help any of you that would like more technical assistance. But I will pass it back to you, Gina.
And I'm going to invite all our panelists to go back on screen so we can answer some questions. But as we said, it's a complicated program, and so it's very important that we help individuals maintain benefits. And we're going to start with this. And Jenny and Amanda, I invite you to jump in whenever. One of the question is, how can an organization support young people in maintaining or obtaining SNAP eligibility by providing documentation that verifies their work or volunteer service with them? And what steps should they take to ensure that the verification letters or forms they provide are recognized and accepted by the county or state or SNAP administrators? Happy to start, and then, feel free to jump in. The number one thing that you can do is check if they have any exemption, right? As both Jenny and Amanda and Katie, who had to jump off, said, many individuals are, they may not have a visible disability. They might have a term that we really hate to utilize, which is unfitness, meaning that there are things that are keeping them from going to their day-to-day. So the first thing that you need to do is talk to them. And as Jenny said, we are publishing a checklist, and so that you can see what are the various exemptions that are out there. But we'll note that the unfitness exemption is interpreted very differently state by state, right? For some states, they allow is it possible for you to drive 100 miles, or it's just as an example. So every state will vary. States also have specific forms that individuals can sign, but for the most part, one of the things that came out of the fiscal responsibility final rule that did make into regulations is that state agencies have the responsibility to help individuals with verification, right? So it's important to know that, and we will go ahead and send, these slides, but also once we publish this final, the fact sheets that Jenny is referring to, you'll have them. And please, our emails will be in the email and the follow-up email, so please feel free to reach out. Jenny, Amanda, anything else you would like to add to that?
Gina, the only thing I was going to add is that, getting involved in your state's implementation process right now as they're developing, taking whatever flexibility they can and describing what the verification process is and who is able. So when I was mentioning, for youth in foster care, other transition age youth who might be less connected with medical providers, but might have a social worker or might have, another caseworker, ideally having those people be able, under the state's policy. And I know you've taught me a lot about kind of the flexibility of when an individual should be able to attest to things and when they can't. So I think being involved in that so you can speak up and say, hey, young people, this is kind of the circumstances they might be in, and we think this is realistic, but also valid sources of documentation.
Amanda, I don't know if you have something to add, but one thing that you did trigger a thought, Jenny, is that what you all can do right now is that if you have a connection with these vulnerable populations, talk to them and see if they're being exempted. Because keep in mind, under the fiscal responsibility, if you're unhoused, if you were a veteran, if you were a youth aging out of foster care, they didn't do a screening list to say, oh, you have a disability, oh, you have unfitness, oh, you have a child, so we're going to exempt you. So it's important to right now, before people are recertified or, the agency contacts them, speak to them and say, hey, can we do a screening? Oh, you fit into this categories. Let's contact the state agency so they can just exempt you. And you don't even have to receive that checklist that will say, for example, dear Gina, you are now, because of the reconciliation law, you're now only allowed for SNAP for these 3 months. So if we can get people before they start those countable months, that will be the action step that we'll be asking for everyone to do. We will share the PowerPoint. We will follow up. Is there any type of advocacy? The next question is there any type of advocacy or legal remedies that can be pursued, keeping in mind how these work requirements require more extensive work requirements that are required, for example, in state agencies? There is a bill, the Restored Families and Farmers Act, that we are asking Congress to, let's go back to July 3rd, before this awful bill was signed into place. Unfortunately, unless this happens, this will move forward. The best advocacy that you can do is work with your state agency to really work on what is unfitness, what are those barriers, so that it is clear, and really just demystify who is on SNAP and who is utilizing it, so that policymakers can see individuals as human beings who are struggling because of the decisions that have been made historically that not necessarily support economic mobility. And always remember that people are policy. Today's election day, so just remember that individuals get to choose how those policies get implemented. So that's what I was saying. Work with your state agency. Tell them you have outreach that your state agency does not have, right? They are at a capacity. You can reach out and help them to really understand if there are other ways that they can help these individuals within the regulations, so that they don't have to go through this. And like Jenny said, individuals who may be going to school more than half time, how are they exempted? What sort of disabilities? What are the ways to make things more flexible in order for them so they don't have to go through multiple barriers? Jenny and Amanda, we're running out of time. Anything else you want to add before we end?
I just wanted to see, Gina, if you do have time for the last question from our colleague Chelsea about family caregivers. You noted whether that family caregiving only sometimes would be exempt, but just wanted to see if you could speak to
Yeah,
a little more to that.
so if you're living, if you're living in a household, and remember for SNAP, you don't have to be blood relation, right? So if all of us here four are living in a household and have a child under 14, the caretaker, then you are exempted. I think when it comes into places, for example, grandma lives on her own, right? She's 62 years old, so she's now have to meet this new time limit. But she's taking care of her grandchild while her daughter goes to school. They don't live together. It's that caretaking, right? Because it doesn't mean that grandma is living with the child. It's just caretaking. So that's when the exemption doesn't necessarily apply, if that makes sense. So just wanted to clarify that. And FRAC and Americans Tax for Fairness actually did a comparison of how billionaires and corporations came out after HR 1 and how very vulnerable populations such as the grandma I mentioned, or the mom who is homeschooling her 15-year-old child, will now be losing their SNAP benefits if they can't show enough hours. So we really do ask in terms of advocacy that you help share that, because these are individuals who really need this help. And thank you all for joining us. We hope you have a wonderful day.